To do what?
A bear hug.
Why do I have to do a bear hug?
So,
I never heard that.
so because of big people, this big
Yeah.
bone, you will have to move out. So you will be able to hear better.
Okay.
Okay? So you ask the patient, is it possible you can hold yourself in a bear
Okay.
hug? Okay?
You can hug the pillow.
Hmm?
You can hug the pillow.
Yeah, can hug the pillow. So she started auscultation and then she move on, she has a bronchophony, right? So your instructor may ask you do two.
Would be egophony.
You can do egophony, you can do bronchophony, you can do the whisper. So we will ask you, so don't worry. If you like she did bronchophony, then I will ask her, can you demonstrate and second one for me? I want to know your skill. I really want to know how you know which one is which one. Okay? And after that, she did a percussion, right?
Mm-hmm.
Did she do the right?
Yes, she did.
You mean the fingers?
Yes.
She went by.
But she did the back and not the front.
Usually, front, you should do the all, anterior and posterior. But during the test, if you can focus on the back, that should be enough. Okay? Inspection, auscultation, palpation, percussion. Okay? Percussion, same thing as you using stethoscope. You know, follow side to side, up and low. Compare side to side, compare up and low. Follow that direction. Okay? And then she also did is do the lung expansion. That is good. That's very important. And then I asked her, she has more time. Finally, she came back. She's thinking about she going to do the phlebitis. Then I will ask you, if the COPD, what will you feel? And she told me she is diminished, right?
That's right. Yep.
Yeah. So that theory, she's right. Okay? For the skill, she's okay.
So why would you fail me on theory and
Unfortunately,
safety?
the top one,
Well, right, but you said on the bottom one that you would have only given me.
any dark side, you're not going past.
I know, but what would you have given me under theory and safety alone?
Safety, for the skill, I probably will give you, okay, good, 3. I can do that.
Even though I didn't identify him and wash my hands?
Because no matter what here, you are in the dark. So just know.
So she wants me to feel better, okay.
Okay.
But then if you give her a 3, then she passes. But
No,
she
she
needs to
fell in
get
the
8
dark.
out of 12.
Any part of the dark, you're not passing.
So if you,
So
if I,
you square or no?
It's 8 out of 12.
Right?
8 out of 12, as long as you don't have anything in the dark area.
As long as you don't have a dark area. If
If
you have
you-
a dark area,
Doesn't matter what you get. on
doesn't matter
anything
what you
else.
get, point.
Okay,
Okay?
I know. So what I failed 2 out of 2, okay. Thank you, May.
But you did good. But
Next year we can do well.
unfortunately, sometimes it happened to the hospital, you totally do the wrong patient.
Okay, would you do just a quick, I've got pneumonia.
Okay.
Okay, and I'll sit at the end here so that,
Right now, I have a pneumonia patient. Okay. Ideally, I come into the patient. I know I grabbed my case. I know my patient is coming from the ER, complaining about the shoulder breast fever and coughing. So I'm the nurse. I know her name, Mrs. Sufil. I'm coming here. Knock, knock, knock. Hi, Mrs. Su. My name is May Sather. How are you doing today?
oh, fine, I'm fine.
Okay, can I look your ID? Let me make sure I have the right person. Okay, Sue. Okay, what's your last name?
Feel.
Okay, and then what's your date of birth?
12:10.
Okay, that's right.
Remember that?
Okay, so I got a right patient. I'm going to ask you a few questions. I heard that you came in because you cough, you have fever, and we already checked your temperature is high. And tell me a little bit about how long you been the cough?
Oh, at least 2 weeks.
Oh my goodness, why took you so long to come here?
You know, I was just too busy.
Okay, have you taken any medication at home?
You know, just some cough syrup.
Okay, can you tell me when you cough and you have any sputum?
Yes, I do.
What kind of cough color?
It's kind of yellow-green.
That's not good. Okay, anybody sick in your house right now?
Yeah, my husband is.
Okay, so he has not been treated either, right?
No.
Okay, tell me a little bit more about yourself. Do you have any other medical problems such as like asthma,
No.
COPD, and heart problems? Okay, do you smoke?
No.
Awesome, that's very good. Okay, now, when I'm asking her question, we expect you ask a proper question. Pneumonia, we would like to know, how do they cough, and then do they have any asthma? Because asthma cough too, okay? And also I would like to know that she has been treated. And then so it will help me can listen because sometimes they already self-treated, maybe I pay more attention. Okay, and then between when I'm talking inspection, I already look at her skin color. So instructor will ask you inspection because I cannot read what did you see. So I will ask you what you inspect. I will look at her skin color, okay? I will look at how she breathes, okay? I will check in that she uses exercise muscle to breathe, okay? And I also will look at your possible, I may check the clapping finger, okay? But pneumonia, and since she has no asthma, no COPD, I may not need to do it. If there's COPD asthma, then I'm asking you, can you put your two fingers together, the middle one, face to face? Well, you have tiny little bit diamond shape. Be careful with that, okay?
How's that?
The big diamond's better. You have a little bit. You're okay. Okay? When I say big diamond, okay?
Well, how do I get a big diamond?
Well, the reason why, because sometimes if you have a short of oxygen for longer time and then you build up your tissue, so you're losing that angle. So then you don't have a diamond shape. Unfortunately, I don't think you can get diamond shape because if you have a chronic problem.
But I don't.
Yeah, okay. So then, okay.
Okay.
All right, and then I will come to look at the side. I will try to look the AP and the chest. See her chest, okay? And ideally, like I say, when we do the inspection, I should open up to look at her. Have any problem, such as like a scar, such as like abnormality, such as like maybe they have congenital problem around here. So after I done my inspection, I will start do my auscultation. Everybody, up to you. Inspection, auscultation, percussion, palpation, whatever you want to do. Okay, for me, personal, I prefer do the auscultation. So I will put on my stethoscope on. I will warm up my stethoscope because it's always cold. And I will ask my patient, you're going to help me take deep breath in and out when I'm checking for you. And then I was, doesn't matter which start you start, okay? You can either ways. Okay, can you help me take deep breath in? Take slow in and out. Okay, in and out. Okay, in and out. I compare this side to that side. Right now I compare upper and lower. Okay, I go compare the side to side. Take deep breath in and out. Good job. Okay, in and out. I compare upper and lower. Right now compare side to side. Take the in and out. Now I'm going to compare up and lower. In and out. Good job. Okay, in and out. Okay, for anterior probably that's okay. Okay. Otherwise, you should be able to do the non-expansion. You can do percussion, you can do palpation, but for test on, that's okay. Then I will ask you open your arm. I'm going to listen to the side to side. Take deep breath in and out, and compare side to side, in and out, up and then lower, in and out. You feel dizzy? Okay, good job. All right, now I'm coming to the back side. May I move you? Can you jump off the first? Up, off the bed. Up. I'm going to move this bed so you can facing that. You want to sit or you standing?
I can stand.
Okay, so you're standing. I will ask you, can you do the bear hug? Okay, and try to lean forward. Okay, I can start, since my stethoscope is still on, I'm going to